للأطباء برعاية البالمد بيلقيها الدكتور عنان شتيا للمحاضرة الأولى اليوم. دكتور عنان شتيا غني عن التعريف، بس سريعا هو خريج جامعة القدس، أكمل تدريبه في جراحة الأعصاب في بريطانيا، حاليا أخصائي جراحة أعصاب وأكاديمي في نفس الوقت. راح يكون معنا في سلسلة المحاضرات. تواصلنا مع العديد من الزملاء على أساس إنه ننسق المحاضرات بحكم إنها أول محاضرة لليوم أو في السلسلة اللي حنبتديها. راح تكون للجميع فيما بعد، وبناء على الفيدباك اللي أخذناه من بعض الزملاء راح نفصل المحاضرات المستقبلية لنوعين، للبيجنرز أو للأندر جرادويت لطلاب الجامعات، وللريزيدنتس ومقيمين التخصص والأخصائيين، على أساس يعني نعطي كل حدا حقه ونبلش مع الكل من المستوى اللي هو فيه. دكتور عنان، إذا حابب تبلش قبل ما يدخل الباقي، أهلا وسهلا، تفضل.
السلام عليكم الجميع، أهلا وسهلا فيكم، وبنتشرف إن نكون معكم اليوم. وبحب أشكر زملائي في بالمد على جهودهم الرائعة من أجل مساعدة إخواننا وأهلنا في البلد لتطوير النظام الصحي أو لتحسينه بشكل أفضل بالاعتماد على الخبرات الموجودة في الخارج. وإن شاء الله بتكون بداية خير، وبكون عندنا نشاط أكاديمي وطبي معكم الجميع. وإحنا أصدرنا قبل فترة بشهر 9 مجلة علمية، نأمل أنها تكون وصلت للبعض منكم، تتناول مواضيع البحث والتخصص ببريطانيا. وإحنا مستعدين بإذن الله تعالى على أنه نكثف جهودنا مع بعض من أجل النهوض بالنظام الصحي بفلسطين. لي الشرف أني أكون معكم، وأني أكون خريج فلسطين، ابن فلسطين، خريج جامعة القدس، الدفعة الثانية درست في جامعة القدس، تخرجت بال2002 وبعدين جيت على بريطانيا. هنا حصلت على الدكتوراه في علوم الأعصاب السريرية ومن ثم جراحة الأعصاب، والآن بشتغل بين مستشفى سان جورجز وساوثهامبتون بالأبحاث وجراحة الأعصاب وجراحة السباينال سيرجري. فإن شاء الله هلا العدد بيزيد، فممكن إنه نبدأ بالمحاضرة خلال دقيقتين 3، نخلي المجال لزملاء منا إنه يشاركونا على أساس إنه تكون الفائدة أكبر ما يكون بإذن الله تعالى. بسم الله الرحمن الرحيم. For organizing this series of career development skills. Today we are going to talk about research papers, writing skills and publication. Why these things are important. Why is research important? The aims of research are to inform action, gather evidence for theories, and contribute to developing knowledge in a field of study. Why research is necessary and valuable: to advance knowledge for the good of society, to improve the health of people worldwide, to find better ways to treat and prevent disease. Research has become an enterprise, an economic engine for nations, a necessary step on the way to economic growth. And in fact, if we look at the last point, this is the situation nowadays, in Corona, and the vaccine. So people who invest in research, they will find the outcome. If you pay less to research and medical health development, then you will suffer as a consequence of that, unfortunately. And for you as a doctor, what's the importance of research? Career progression. Often, nowadays, it's a requirement for completion of a training to publish papers, clinical papers, basic science papers, or whatever you can do. And it's an essential part of appraisal and revalidation. For those who don't know what revalidation is, that this is a system for revalidating doctors in the UK. For example, you get a license to practice, for example, for me in neurosurgery, other colleagues in medicine, etc. And then this is not the end of the road. If you've done so, then after 5 years, you have to revalidate, i.e. to send all your papers through GMC to acknowledge you as a practicing physician that fulfill the criteria to continue practicing. And part of this revalidation is to show that you are doing research or clinical research and publishing papers, attending meetings, and developing your career. So that's actually important. And I heard that for completion of the Arab board in medicine, you need to publish some papers or a paper. Now, this takes us to the level of evidence. We often talk about, we recommend this medication, we recommend this procedure, where this has come from. There is something called level of evidence, and there is a ranking for the level of evidence. If there is a strong level of evidence, which here I simplified it in this table as A to C, and the Oxford level of evidence ranking between 1 and 5, it's a little bit more detailed, but this will do for just general understanding. So level of evidence A, which is the strongest level of evidence, where the advice to give this treatment or to do this procedure depending on meta-analysis of multiple randomized trial. And the weakest evidence, which we call it here C, comes from consensus opinions of experts in the field or case studies, etc., etc. Now, depending on the level of evidence, there will be a class of recommendation. So we have first evidence, and then we recommend either to give the treatment. If there is a class 1 recommendation is the condition for which there is evidence or general agreement that this is beneficial and useful and effective, so you have to do it. Class 2 is there is conflicting evidence, some against, some with, but class 2A, the ways of evidence opinion is in favor of usefulness. Class 2B, it's useful, but it's well established. Now, class 3, there is enough evidence against that treatment or that procedure. And if we look at this colorful representation, so class 1, we said there's benefit hugely more than risk, and then you should do it, should. Class 2A, there is benefit, it's more than the risk, it's reasonable to do it or to perform the procedure or give the treatment. Class 2B, benefit more than risk. So, but it's not a hugely, but it is, it's still beneficial. Then the procedure treatment may be considered. But when there is a class 3, the risks are more than the benefit, then you shouldn't do it. So I think these are important terminology we should understand. So when we hear about, especially for medical students, and I know my practicing colleagues will know all of this, but for medical students and early career junior colleagues, will need to know this so they can, the level of evidence, why we hear about, why this is class 1 or class 2B or whatever. So we understand these terminologies. Now, research. So in order to write a paper, you need to understand what is this paper all about, So primary medical research can be subclassified into basic laboratory studies, and these are applied studies like doing animal studies, cell cultures, genomics, pharmacogenetics, etc., or theoretical development of methods. So these are basic laboratory studies, and these are essential studies in order to allow us to proceed into answering clinical questions. So most of the time we start with animal studies and basic lab studies in order to advance into clinical. Then we go to clinical studies. So clinical studies can be interventional experimental, like clinical trials to randomize trial, give a medication for a group of people and placebo for the other and look at the outcome over a period of time. And the observational studies like writing case reports, looking at the group of patients, their outcomes, what this treatment has given us in terms of complications, risks, etc. And most of the studies lie within most of the papers that we write in the clinical field lie within observational part of the research rather than basic science, etc. especially in Palestine and most of the other Mediterranean countries. Now, epidemiological studies is a totally different cohort of studies, can be interventional and can be, case control, cross-sectional, etc., etc. Now, if we join between laboratory studies and clinical studies, we do what's called translational studies, i.e. we use our animal knowledge or whatever we did in the lab in terms of basic science or looking at tissue from humans, and then translate that into, answering a specific question to introduce a clinical judgment or treatment for this specific condition. So, and it's a quite nice, but it's lengthy. I mean, if you have to go through the being basic scientist as well as a clinician, but I think it is essential to have some people with these skills to understand basic science and build on clinical translational research. Now, in order to write a paper, you need to understand some definitions and terminology. What do we mean by clinical trials? These are studies of a drug or surgery or medical device in healthy volunteers or people who have a specific disease. So if you hear about a clinical trial, it is, give a medication, try this procedure, try this option of a treatment, in volunteers as well as a specific disease. Observational studies, these are studies in which a group of people is observed for many years. Now, there are also behavioral studies, genetic studies, physiological studies, and all of these different types of studies looking at various conditions and studying specific diseases to answer a specific question. But I thought the main points is just clinical trials and observational studies. Most of the studies we do in clinical practice are observational studies. Now we spoke about the level of evidence and the strength of the level of evidence. We said the strongest one will come from meta-analysis. Meta-analysis analyzing previous studies, and the strength comes from, pooling the data from the previously done clinical trials or randomized clinical trials and analyze it to give us an outcome of a pool of pooled data. And that's the strongest. So this is the pyramid of research or level of evidence, and comes from the meta-analysis, which is the strongest evidence, down to the case reports and expert opinion, comes at the bottom of the pyramid with less, as we say, power or less strength. If you look here, I mean, these are the observational studies like case reports, cohort studies, case control studies. Now the experimental studies like randomized control study, quasi-experimental studies. What is quasi? Non-randomly assigned groups of patients to receive either treatment or placebo. So this is often the case if you have one specific procedure that you want to apply to all these patients. Now, how to write a clinical paper. So there are general points we want to talk about. Research and audits are essential and important part of the clinical training. As we said, I mean, the main aim, I still remember, and I reiterate this story, I mean, in early 1990s, the main aim, I mean, many people were fighting in Palestine to establish a medical school. It was a challenge. And when we entered the medical school, we were told, it's not going to succeed. Forget about it. But with the efforts of everyone in Palestine, without mentioning specific people, it went ahead and it was a success, alhamdulillah. And the main aim of establishing medical schools and now schools, alhamdulillah, is to improve the healthcare service in Palestine with all our efforts together, and the quality of a trainee. And this we have achieved. And now we are, we should focus, all of us, on improving the healthcare service in Palestine to become much, much better than it is at the moment. And inshallah, with your all efforts, we will do that. Now, in order to write a paper, read. I mean, without reading many papers in the field, it's difficult to form a concept and be able to write. So that's the first step. In order to be able to write, you have to read and work as a team. One person in charge. So yeah, I mean, I always say this: if you want to fail, work alone. If you want to succeed, work as a team. Each one has a talent. Each one of us has a skill. If we use all the skills, we will be able to achieve much better and reach and publish, and I'll show you examples as we go along. So yeah, work as a team, but if there is a project or a paper, one person should be in charge to, to push things forward and assign tasks to the co-authors. So if we have 5 co-authors, okay, so you collect the data, you analyze it, do the stats, check this, you review the literature, you start the drafting. So that's how it works, you see, and one person in charge who should move these things forward and get it into the right place at the end. Now, regarding publication, there are many different types of publications and many different avenues for publication. Starting with a simple case report is often a good beginning. So you don't need to jump into a very high impact factor journal with a very high impact factor project, because that's gonna be a challenge even for well-established academics. So start with simple things. You have the taste, you feel it, you try it, and then you can move forward. As we say, if you are targeting high impact factor journals and doing high profile research, there are rules to cover that, like CONSORT. CONSORT, we will mention what that CONSORT, and PRISMA guidelines. So for example, CONSORT reporting guidelines, these are just guidelines. You don't need to memorize those, and I don't memorize them. Whenever, we come across a randomized trial or something like that, we read the guidelines and we follow them. It is just quite straightforward and simple. And that's what, as I say, there are rules to govern reporting clinical trials and studies. PRISMA, this is the system if you are reporting or studying a systematic. Sorry, I'm just. Give me a minute.
نعتذر عن بس قطع الصوت دكتور عنان.
I'm really sorry, I'm back. Can you see
تمام.
me?
هاي دكتور عنان بسيطة.
Sorry.
تفضل بسيطة، حصل خير.
So we were talking about PRISMA. PRISMA, it's a transport. It's a reporting system for systematic and meta-analysis. And it's quite important to understand these, because basically it is one of the things that you can do. You don't need money to do. You can do in Palestine, you can do anywhere in the world if you know how the system works. So this is the PRISMA flowchart, which basically shows you once conducting a systematic review, you have a question to search or specific terminology to search to give you the number of articles that, for example, brain hemorrhage, for example, brain hemorrhage with, with poor outcome or something like that. So then we'll give you the total number of articles that you identify. This is called the identification process. Then you go to the screening process, where usually two of the authors will go through the titles and the abstracts, exclude unrelevant articles, and then you go to the eligible articles, and then you include the final number of studies. So I'll give you an example of this. So this is a paper. I I published last year, and basically it's about one of the treatments we use for malignant MCA infarction. And so it's our experience. We've done some cases, and we researched the literature and performed the meta-analysis. And as I say, I mean, it's the expertise of the team. So I led this project. This chap, he's a senior consultant neurosurgeon in London, and he was the person who started this this hysterectomy procedure and taught me how to do it. You see, so and this was a medical student, then now a junior doctor who collected the data and done all the groundwork in terms of collection of the data. And this and a senior nurse who's specialized in who's a statistician, who's done the statistical analysis for the study, another neurosurgeon who helped us with the study. This is a neuroscientist, and this is a neurologist. So the whole team worked together and to come up with this paper. And as I say, I mean, even if the procedure is not well recognized, you can drive the force, you can show some evidence, and it's quite important. And this is our identification, you know, of or the PRISMA guidelines that we've done for this study. So for example, I mean, we went through all of these databases, we recorded 122 articles, removed the, excluded the duplicates, then we went through them. At the end, we ended up including just 3 studies, just to show how many you might, you know, might get hundreds of papers, but at the end you include a few. It's all about your question, your search criteria, and what is out there in literature. So, and these sort of studies, easily you can do. I can say, I mean, if you have a specific interest in something, you can do the study, you can do a systematic review. A meta-analysis and pulling and analyzing the data, and that depends that you need really proper statistician to help you out in that. And we have statisticians, alhamdulillah, everywhere. So how to write a clinical paper? Writing in scientific English requires economy of style and linguistic restraint. Many readers will not have English as a first language. However, you have to be careful with this, because basically you have to write in a really accurate, proper, professional English language, because the editor will be, you know, will look for this carefully, as well as the reviewers. So you have to check it again and again and get a proofreading if needed. So the conventional scientific or clinical articles are written in what they call it IMRAD style. First, basically what's the IMRAD style is introduction, methods, results, and discussion. So that's the body of the paper. Now, once you decide to write a paper, you say, which journal I want to use. And this depends on multiple factors. So you have to think, who will be the readers of this journal? Who are the potential reviewers? Who review these? And what's the impact of this paper or the impact of the journal? Who also depends on the readers. And there's something called impact factor, which I'll mention in a minute. And what this paper helps me, because obviously, yes, we are interested in research and academic progress, but this has to give us something back, isn't it? You know, help us in our career, help us improve the, you know, the patient care in our hospital, help the economy in my country, all those sort of things. So choosing a journal is not easy, and there are factors we consider. So journal scope, how many articles they accept roughly, journal indexing, impact factor. And we often hear about impact factor. It's quite important, because the higher the impact factor is, the better the journal. That's a general knowledge. However, what does impact factor mean? So they say the impact factor, basically the number of articles. For example, if we take 2018 and 2019, the number of articles published in those 2 years that been cited in 2020. So for example, if the impact factor of a journal is 6, the average paper published in 2018 or 2019 should be cited approximately 6 times in 2020. So that's how they calculate the impact factor. Language of publication, most of the, as we know, we publish in English. I don't know of any, maybe, I don't know if there's any, some for example, French papers, but I don't think we are interested in anything other than the English. And likelihood of acceptance. So you think of a journal that you have a high, acceptance rate, or that, you think your project will easily fit into the policy of that journal. So all of this come along when you go through multiple journals and start publishing. Speed of publication, yes, I mean, some journals might publish in a couple of months, some might take a few months. So again, it depends how desperate you need to publish that paper. Maybe, if you leave it a bit, then competitors will get the idea and will publish before you. So all of these. And open access or not. So what do we mean by open access? Some journals, you have to pay money to get an open access, i.e. there are fees to publish your papers for the open access. And it's quite good if you are able to, and some institutions have money put aside to do so. Because if you have your paper published open access, then the likelihood of it being read and cited higher than the closed paper, or the one that you need specific accreditation to access those papers. As I say, publication fees all depends on if it is open access or not open access. And editorial and peer review policies, all of these, I think you have to be aware of them, but once you start publishing, you will come across, good reviewers, bad reviewers, but again, it's all about what that journal interest is. Now, again, when you start writing a paper, read instructions for authors. So there are, it's quite easy, straightforward. When you click on that journal, there is a session on the top or an icon which says instructions for authors. Go through them thoroughly, because that's how you write the paper. That tells you what you need to do when you write the paper in terms of, number of words, referencing, etc., all those sort of things. Now we talked about the IMRAD introduction. So the first one in the IMRAD is the introduction. Why ask this research clinical question? So you need to explain this in the introduction. So brief background for the audience. It's about 3 to 4 paragraphs only. You don't need to write a lot there. You need to just simplify and explain what's the question, what's the research question, what's known about it, what's not known. And you have to state the research question clearly in the last paragraph of the introduction. So because of the lack of knowledge in this certain field, we have performed XYZ, generally speaking, to answer this question, obviously. And why the question matter? Again, because of this important point, important treatment, important complication, we decided to write this paper or to do this study. Because obviously, the paper coming of a study, it's not just a paper. You see, you've done it because you want to answer a question. Methods, very important. And what did I do? It's as simple as that. This is my method. Should be like a recipe. Most important section for informed readers. As I say, I mean, I review papers regularly, and the first thing I look at the methods. If the methods are obviously after the abstract, which I'll come to it at the end, but after the abstract, I look at the methods. If the methods are convincing, robust, then the paper will have either the outcome is positive or negative results. It will be solid paper. And have they followed the guidelines? We talked about CONSORT just briefly, but again, Prisma, if you are doing a systematic review, then you should follow the guidelines. If it's following the guidelines, that's encouraging, you are encouraging the reviewers and the editor to accept your paper. And describe measures to ensure ethical conduct. Ethics is quite essential, and we will give it a bit of time. and fully describe and give references of lab and stats methods. So you have to describe fully what you have done and all reference all of these. And the methods now, they describe it as PICO or PICO, elements of the study. So P, which patients, which population, what the problem was. I or E, which intervention or exposure. C, which comparison group, and any randomization or stratification, and all outcomes or endpoints. Define primary and secondary outcome. So if you write a study, then there should be a primary outcome for your study, and also some secondary outcomes. So the primary outcome usually one or more main outcome, and secondary there may be a few secondary outcomes. Ethics is quite important and essential. So and that's, you know, if you any study without ethical statement won't be published, from a simple you know, case report to a very high quality you know, randomized trial. What was the consent procedure? This has to be explained. Were there any deviation from the normal practice? Might the publication reveal patient identity? This is quite essential, because what we do when we talk about patients, we talk about linked anonymized data rather than, you know, any data that reveals the identity of the patient. So ethics is quite essential and important. And even if you are doing a you know, a case report, it's quite simple. Phone the patient, speak to the patient, say, I want to, we all consent to write this, and will not release your photos or pictures. It will be anonymized, all those sort of things. And I never come across a patient so far who refused us to publish their case or to publish their anonymized data. So there will not be known who these were. So that's quite important. And if you are doing an audit within a hospital, you have to follow the hospital guidelines in terms of registering that audit. Because again, if you come to publish that, you need that registration declaration in your paper. Now results. About the methods, now we go to the results. What did I find? As simple as that. Report results fully and honestly, as pre-specified. You've done the methods, you've done the study. What you found, you have to report. So you have the text, tables, figures. These are the things that, you know, you show your results in. So text, it's a story. So just if I'm telling you, you know, we went to the park, we had some tea, we had a sandwich, all that sort of, then you put tables with the evidence. So for example, you know, the patient's demographics, you know, the, for example, Glasgow outcome score, all those sort of things. And then some figures. If I'm talking about subarachnoid hemorrhage or, for example, brain hemorrhage, then I'll put some scans. So to help people understand what I'm talking about. So these are all supportive of what I found. And as we said, we have a primary outcome. We should report that. And we have secondary outcomes. Now, give confidence intervals for my results. So if you have done statistical analysis, you have to give the confidence interval. As I say, the stats, you should summarize the statistics that you have done. You have also a leeway where you can report more data than, you know, what you are allowed to, because as I said, read the instructions, author's instruction at the beginning, and they will tell you, for example, you are allowed 4 figures, 2 tables, etc. So you can't present more than this. But what you can do, you have supplementary file where you can basically add whatever you like. And then when you describe your results, you can point out that this in the supplementary file, S1, S2, whatever. Don't discuss while you are writing the results, because we are coming to the discussion. So the discussion basically, what might it mean? So don't simply repeat the introduction, but include statement of the principal findings. So what you found, summarize it. So often at the beginning of the discussion, the reader would like a summary, a quick summary of what you have found. And then why your paper is strong, why your study is strong. what are the weaknesses? At the end, most of the time we write limitation of the study, retrospective study, its limiting factor, the number of patients, etc., etc., etc. So as I say, I mean, and then you compare your study to other studies and you try and explain your results. What does this mean? So, and again, this comes from your understanding of the pathology you are dealing with, and also comes from reading the literature. So you say, well, I think these patients bleed because they don't take anticoagulation, or they take anticoagulation and their age is high, they're older people, etc., hypertensive, they bleed. So for example, this is one of the things. And there will be unanswered questions, and these refer them to future research. Because you don't want someone, when you submit a paper, come to you say, you know, this doesn't answer this question. I know it doesn't answer it, but this will be my target future research. So it's quite important. And if we are talking about, you know, some change in strategies, some change, that's important, because that will impact on the policymakers and on the clinical commissioning in the hospitals. So abstract, you probably said he didn't mention the abstract, but I left it until the end. This is the caveat of your study. And it's quite difficult. As I say, I always leave the abstract until the end. Once I write the whole paper, then obviously there are guidelines how to write the abstract, in terms of, you know, there are some structured abstracts and some unstructured abstracts. Unstructured abstracts are more difficult than structured abstracts, because if they are structured, they follow a specific format, then I know what I have to write. If it is unstructured, then I have to make it one paragraph, getting my introduction, methods, results, and conclusion into that one. So yeah, and it's important, give it some time to write the abstract. After you put all the results together, discuss your paper, because that's what the editor reads. So the editor will read, most of the editors will screen the paper you submit according to the abstract. If they feel that the abstract is weak, then they will reject it straight away. And this happened with me, so it happens with any one who submits papers. I usually write it in the active voice. If you've done the statistical analysis, then put the p-value and no references. So in the abstract, you don't write any references. And if it is a clinical trials, then you have to write the trial registration. But all of these will be the guidelines will be into instructions for authors. So logistics while writing a paper. As I say, read instructions for authors in details. Now, when you start writing it up, there's the first thing you write, well, at the end, putting things together, there is a title page. Title page, basically, it's got the title of your paper, the authors and their affiliations and their degrees of affiliation, sometimes the corresponding author details, a number of figures and tables and number of words, all of those in the title page. Now, be careful to the word count, you see, because that's, you know, you don't want to, if you are allowed to write 2,000 words, don't go for 3,000. If you are allowed 6,000, don't do more. If you do less, that's fine, but you're not, you know, I would say you might be able to write more, but that's depending on the editor's decision. You see, don't do it on your own. And believe me, when I review papers, I first look at the abstract, and then if they are following the instructions for authors. So if it is written crystal clear, like what the journal advises you to do, then it's the likelihood of this paper being accepted is higher. And basically we say, you know, it's a well-written paper. Or sometimes they come back to me and say, it's a well-written paper, but unfortunately, we don't, you know, these are the reasons why we are not accepting it. So it's important to follow instructions for authors and stick to their guidelines, because basically this will maximize your chance of getting the paper accepted. Figures and tables, as I say, there will be each journal accepts a specific number of figures. Don't go over them, just follow that. Now referencing is quite essential, and it's important. And that's you have to use a sort of reference manager. So I use EndNote. However, there is Mendeley. Mendeley is free, and you say how to use it. It's quite, nowadays things are straightforward and easy. Go to YouTube and watch a video. It's easier than, it cannot be easier than this. And then at the end you write acknowledgements. Anyone helped you, not necessarily contributed to the paper, then you acknowledge those. Acknowledge any funding bodies. So if someone is paying you to do specific research, then you have to acknowledge those and write a funding statement for them. Ethics also, the paper include at the end ethics and consent statements and conflict of interest. So for example, if you are doing a study, this is important. I mean, if you are doing a study funded by a company, for example, and that you are studying a product of that company, you should declare conflict of interest. You should declare it in your paper that I have been funded by, for example, whichever TIVA, and these are the outcomes. So at least people understand, when they review the paper. And supplementary materials, as I say, there is enough space to accommodate whatever data you have or figures you cannot get into the actual body of the paper. Now, before the submission process, what I want to say, I mean, how I write the paper. First of all, my tips for you. I read about the subject. So it's not necessarily I have the deepest knowledge about that specific thing, but if I'm interested in a question, first of all, there should be a question to answer. Why I'm doing this? Is this new procedure we are studying, is the outcome worse or better? Is this medication causes complication, or so there should be a question. Then once I have a question, I need to find out what's being done about it in the literature. It's quite easy. You go to PubMed, you search, for example, treatment of diabetes with X medication, and will come with loads of papers. You need to understand that before doing this study, that no one has done it before, and that's quite important. So do your search, have a question in mind, do your search first, and then often people talk to me, say, Anan, this is important finding, or this is really rare. How do I know? I mean, I'm not the I know everything about everything, so I go and look it up. If it is really true what they are saying, then we can think about what is really relevant in this case or in this cohort of patients, and what is the angle of publishing, what is the angle to study. So these are my points before even conducting the study. Now I have the data. How to write, as I say, read the first thing in writing, and then I get myself, or I encourage myself to write. The first thing I do, I put the a frame of the paper. So abstract, introduction, all of these, just the frame, the titles, you see? And then there are things that easy to write, like, methods. I always write the methods first, because it's something I've done, you see? So it's not something hugely, needs invention. Write the methods, then the results, things I found. Then I go and write the abstract, the introduction. The last thing I write is the discussion, because you see, you need a bit of, to compare with other studies, but I've already done the literature search when I did the introduction, when I wrote the introduction. You see, when I'm studying, when I prepare for the paper. After writing all of this, I go back and write the abstract. Now, we've done the paper, we've written the paper, but the submission process. So managing the paper through the submission until publication, it needs patience. So, and you have to, you know, take it easy, because, you know, otherwise you can't maintain the momentum to keep going with these things. So I always aim high, but be realistic. So if I have a, you know, a project, I want to publish it in Nature, of course I do. But would it reach Nature? No. So I have to push myself down. So I often apply for higher impact factor journals, but in the background, I know the likelihood, perhaps if this fails, then I should go to another, you know, journal. Cover letter to the editor. So I always write a cover letter and explain the important 2 points in the paper. And that probably will encourage the editor to look at my paper, or just doesn't like it. So yeah, that's quite difficult to write, but as I say, be really careful, and you have to write actually very, very important findings to encourage them to have a look at your paper. All of you, all co-authors should approve the manuscript. Read it again and again and again, because, you know, sometimes there are silly typo mistakes. You don't want them to, you know, you can easily identify, but if it is the middle of the night, you know, you haven't slept well, so take a deep breath, read it again, get your other co-authors to read it. You sometimes, if you know someone expert in the field, you can ask them to critique the manuscript for you. Then, you know, while to submit the paper, get all authors, co-authors, affiliations, titles, email addresses. There are certain journals allow you to exclude certain reviewers. So if I have competitors in the field, and I think I can't say I don't want X and Y to review my paper because they are competitors. And some journals ask to add names of reviewers. You should know some people in the field. It's not difficult to find out. Now, once you submit your main body manuscript and the figures, everything, you've done all that, then at the end, the journal generates a PDF file for you. And this you have to review carefully before submitting, because if you just click the button submit, then it will be submitted. So what I will do usually, I download the PDF file, go through it again and again and again, ensure I don't even do it on the same night. So I sleep on it. I read it second day with a fresh pair of eyes. So that will help you to, you know, to identify any silly mistakes or any. I know you probably won't change the whole concept, but you might identify things that you don't want the editor or the viewers to see. And then nowadays you need what's something called the ORCID account, which is Open Researcher and Contributor ID. So this is the ORCID. So it's quite like your, you know, passport ID or ID you have. So basically, it's for free. You just need to register where you are and just register your details. All of us got ORCID ID. And nowadays it's essential. Most of the journals, almost, I mean, all the journals I submit to, they ask for this. The main aim of this perhaps to connect researchers together, but for you, you just need to register what you do, your level, etc., etc., and it will keep a track of your papers and also if you are a reviewer with the journals that you review for. So the revision process. So we submitted. Now, what's the outcome? Either they will accept it, and it's rare. I mean, I published a good number of papers, and rarely they accept without any minor revision. So they accept usually most of the time with either minor revision or major revision. And it depends on what they ask, what their queries, what the reviewers said, and then you try and answer those in the revision. So what if the paper is rejected? Yes, you should have plan B. You know, I go to that journal, I go to a different journal, I change, and I benefit from, if my paper is rejected, there will be reviewers with comments. So I take those comments and work on them. If I'm able, for example, to address the points that these reviewers rejected the paper on, then I'll do it, and then I'll go to plan B to submit my paper to a different journal after addressing the points that were raised in the previous submission. Now, if your paper has been accepted, but there is a revision, they ask you for either minor or major revision, you write the rebuttal. Rebuttal, basically, you answer the reviewer's questions point by point. Write a letter, I put each question or each point they raised and what my answer to that and how I address this in the manuscript. And I track the changes. It's straightforward. When you write Word document, you track the changes, it will appear what you have done. And that's, when I review papers, I want to see if the authors addressed, the points I raised in order to accept or reject their paper. Again, get all co-authors approval and review again. Once you submit your revision, review the manuscript again and again. Now, I just want to go through some of the papers I published just to show some of the collaborations. And, as I say, start with simple things. This is a clinical image. So this is a small paper, clinical images. So it's 150 words. So it will take you a couple of hours to write. And how we come through to the idea. So this one of my colleagues in Jordan, consultant neurologist there, he phoned me up, said, I have this case. What do you recommend as a neurosurgeon? So we reviewed the images and we found this is really interesting. And we've given, the advice in terms of surgical, non-surgical, as the patient had the bullet in his head for 40 years. And it was interesting, actually. There's an educational point here. If you come across this, which is quite rare, then you don't need to do anything surgical in this certain situation. So it's collaboration. So I'm here in London, I'm this chap in Jordan. So we discussed the case and we thought there is an educational point and we published it. So different specialty, as I said, different skills. This is, another important case. We reviewed the literature, something in the brainstem in a child. So I led this study and other neuroradiologists, neuropathologists, another couple of neurosurgeons. So that's sort of collaboration. And, other things, important rare findings with educational points. So yeah, there are a lot to say here. Now, there may be a big study and you may have to change according to the findings. So we first studied our series of brain AVM in children. It's a quite rare condition in children, cause bleed. So me, academic neurosurgeon, this is interventional neuroradiologist, and this is really senior neurosurgeon who just returned, in fact. So when we submitted the paper as our series with the outcomes, etc., and we identified specific time point when the patients bleed. And our paper here was challenging the literature that AVM is not congenital because we don't see children bleed before puberty age, for example. So the editor came back to us saying, why you don't do a literature review of all AVMs in children to look at the age with when they first bled. And that was, a redirection by the editor. So that's what I mean. You have to follow the advice and do what is you feel better. So about expertise and skills. So here, group of us, this is a part of a series of papers, in fact, and presentations looking at neuronavigation to put a drain in the head for patients with hydrocephalus. And so this one of my colleagues who collected the data. So we generated the database, and that's the first step when you think of generating studies. So if you have a database, for example, you are a hospital that treats hypertension. If you have a database of your hypertensive patients who were admitted to the hospital or visiting the clinic, etc., and you collect all this data for these patients, you will be able to look at this data, analyze it, and find interesting points. And that's what we did. And we published this paper, we published this paper from the same database. It's just different analysis, different angles, different interests. And regarding the policymakers, so this paper, the center in Southampton was the only center in the UK that used this technique at this bedside in intensive care, you see. And we found what we reported is safe, saves money, saves about £1,200 per procedure, which is a lot of money if you're talking about you do this 50 of those a year. So 50,000, 60,000, it is a lot of money. So that's what we say. And then now, after we published this paper, few more centers in the UK started doing the procedure. So this is how things change, and you build evidence from what you publish. Collaboration, this is a paper came from Jordan, from Hashemite University and Prince Hamza Hospital. Not we are interested in politics, but this is just the hospital. There's a group of colleagues. One of them was my colleague here, and we collaborated after he went back to Jordan. So they found interesting cases there. They looked at and treated in the hospital, and we discussed. We said, let us do this, write it up as literature review and explain the cases. And yes, so that's what I say. I mean, collaborate with others, users. There's radiologists here, there's histopathologists, a neurosurgeon, other neurosurgeons in Jordan, Hashemite University, and me from here. So use skills and expertise. You can write and generate. Now, if you remember, I mentioned at the beginning, basic science research and clinical, and you do the clinical translational research. So basically, this is one of my basic science papers. It does take years and years to generate a research basic science paper. And to translate that into clinical work is going to take decades. So but this is how it is. So some people spend time doing basic science research and build on clinically afterwards. This is another paper. You see how many co-authors here, and this is about a model of a stroke and some experimental treatment in stroke. Again, it did take us a while to generate this paper. Now, translational wise, I meant to mention this paper because basically this talks about inflammation, neuroinflammation in brain hemorrhage, patients with a brain hemorrhage. And basically we looked at the tissue of brain hemorrhage patients in the laboratory, identifying what's happening and to look at specific targets. And that's what we call translational research. And this took me 2 years to generate this paper. I mean, a clinical study like cohort study or observational study, you might do it in a month, you see, if you have the available data. But for basic science research or translational research, it does take time. And you have to follow the atmosphere. So I'm, spite of being a neurosurgeon with academic interest in brain hemorrhage and stroke. So we had COVID, so stopped us doing other proper work. So we said, let us look at stroke in COVID patients. So yes, and we published our series from St. George's. So yeah, you have to be flexible and look for the atmosphere around you and see what else you can do and how you can help it. So again, I would say thank you very much for attending this today, and hopefully it's going to be one of series coming along. And we did say in the past we are happy to collaborate with through PalMed, happy to establish collaborations with UK partners to help colleagues back home write papers, critique their papers, or I'd give them advice. So the way that they like, I've shown you some collaborations with colleagues in Jordan. I've got collaborators in other places in Saudi Arabia, for example, as well. And would be good if other colleagues be able to write, because if you are a respiratory physician, We have respiratory expertise in the UK, stroke physician. We have stroke expertise in the UK, Palestinians or non-Palestinians who are happy to help, and we can put you through the right direction. Thank you very much for your time, and thanks for PalMed for their great efforts.